Hello friends, welcome to the SK Study, my channel, and today I am try to explaining you the new topic medical surgical nursing में से coronary artery disease। तो फ्रेंड्स पिछले वीडियो में मैंने आपको समझाया कि हार्ट की एक्चुअल पोजीशन क्या होती है, लोकेशन क्या होती है बॉडी में, एंड सेकंड में समझाया इसका फिजियोलॉजी यानी कि फंक्शन क्या होता है। एंड नाउ आई एम deliberating you to that मेडिकल सर्जिकल नर्सिंग हमारा न्यू सब्जेक्ट है। ये एनाटॉमी फिजियोलॉजी थोड़ा सा अलग है, इसमें हम पढ़ेंगे डिसीज़ कंडीशन। तो आज हमारी डिसीज़ हार्ट से रिलेटेड है, दैट इज़ कोरोनरी आर्टरी डिसीज़। तो कोरोनरी आर्टरी डिसीज़ क्या होती है आज हम जानेंगे, और उसके पहले मैं आपको कुछ वर्ड्स हैं जो सामने आपको दिख रहे होंगे। एक तो है एथेरोस्क्लेरोसिस एंड इटियोलॉजी। तो एथेरोस्क्लेरोसिस दिस मीन्स दिस इज़ द वर्ड, इसको हम दो में स्प्लिट करेंगे। देन एथ्रो मीनिंग इज द फैटी मिस। फैटी मिस यानी फैटी मिस यानी कि एक फैट का डिपोजिशन और फैटी मास लाइक स्ट्रक्चर्स। एंड स्क्लेरो दिस मीन्स इज द हार्ट। तो इस वर्ड को जब हमने स्प्लिट किया तो आप फ्रेंड समझ गए होंगे कि इस वर्ड के दो अलग अलग जो वर्ड कॉम्बिनेशन करके बना है उसकी एक्चुअल मीनिंग क्या है। एंड देन इटियोलॉजी। इटियोलॉजी मीन्स इज द रिस्क फैक्टर दैट हाउ कैन डेवलप और हाउ कैन coronary artery disease can occur. So friend, with the help of the diagram I will explain you to that what is the exact coronary artery disease. But before that I want to tell you the definition of our disease is coronary artery disease. So it is a type of blood vessels disorder that is included in the general category of atherosclerosis. The atherosclerosis is derived from two Greek words. This is a Greek word. From this the coronary artery disease is getting developed. So it means a fatty miss, athero means fatty miss, and sclerosis means heart. So it actual meaning is the hardening of an artery. Friends, you already know that the heart is heart में जो blood है वो circulated होता है coronary artery के through. Means coronary artery is the artery which provide the blood supply to the heart, and in which due to the fatty mass hardening of the arteries can develop. This leads to the coronary artery disease. So the condition can occur in any artery in the body. And the atheromass is the fatty deposits have a preference for the coronary arteries. Patients with coronary artery often seeks healthcare from after experience angina or myocardial infarction. I will tell you this myocardial infarction. It is a disease condition which is lead to the coronary artery diseases. Pectoris. These new terms are also the two different disease conditions which lead to the coronary artery diseases. These are also complications cases of the heart in which vascular function is affected. Then vascular diseases such as dysrhythmia, heart failure and cardiomyopathy. This all are the diseases which lead to the coronary artery diseases. But eventually a coronary artery diseases is now more seen in the patients. If you can check out the new current experiences, then you can see that the cases of the coronary artery diseases is increasing day by day. So I want to tell you that how can it develop, or what is the etiology, or what is the risk factor of that diseases. So first be diagrammatically I will show you that what is actual position of that coronary artery diseases. Friends, you can see this diagram. This is the middle cardiac vein. This is the position is the middle cardiac vein, and this is the right coronary artery, and this is the left main coronary artery. This, you can see this exactly. The blood is supplied to the heart is through this artery, coronary artery. Then these are the circumflex branches. The artery is divided into the branches of that arteries, arterioles, venules. I can already told you that if artery is divided into other branches, that lead to the arterioles, and arterioles lead to the small capillaries, and small capillaries blood circulated to the heart, and deoxygenated capillaries lead to the venules, then veins, and this is the cardiac vein. Then coronary artery is artery which supplied oxygenated blood to the heart, and this cardiac vein is the collect deoxygenated blood from the heart. Then this is the branches of coronary arteries, and in which if anywhere is the hardening or anywhere fatty mists are collected or atherosclerosis occur, then it will lead to the coronary artery diseases, because it will create a hindering, मतलब ब्लड फ्लो होने में, अच्छे से ब्लड फ्लो होने में ये हिंडरिंग का काम करता है, क्योंकि जो वेन और आर्टरीज, जो आर्टरी है उसका जो ल्यूमेन है वो नैरो कर देते हैं, जिसके थ्रू से ब्लड अच्छे से फ्लो नहीं हो पाता, काट दी, तो उसके थ्रू ये कोरोनरी आर्टरी डिसीज़ लीड करता है. Then there are many risk factors of the coronary artery diseases, in which first one is the age. Age, diabetes, hypertension, or hereditary, and stress and behavior, and also there are other risk factors like obesity, these all are the risk factor of the coronary artery disease. If these are some sufferings through which the patient or the susceptibility is increases. If age is it is make sure that it is oldest people can get also. Then diabetes is the real, मतलब डायबिटीज़ सबसे ज़्यादा चांसेस डायबिटीज़ होने पे होते हैं कोरोनरी आर्टरी डिसीज़ होने से. मतलब जिस पेशेंट को भी डायबिटीज़ है तो वो कोरोनरी आर्टरी डिसीज़ जल्दी से ससेप्टेबल कर सकता है. Then hypertension you understood that in which blood pressure is above than 140 upon 90 mm of Hg, and heredity means genetically. If family history of the disease means फैमिली में किसी को पहले से है तो चांसेस हैं कि बच्चों को भी वो डिसीज़ जल्दी से हो सकती है. स्ट्रेस एंड बिहेवियर रिलेटेड टू द वोकेशन मीन्स आप जहाँ पर जॉब करते हैं अगर वहाँ का वोकेशनल इन्वायरमेंट ठीक नहीं है, आपका जो बॉडी मूवमेंट प्रॉपर नहीं है, एक जगह बैठने का दिन भर का काम है, तो वहाँ पर बॉडी मूवमेंट होना बहुत ज़रूरी है. तो उस चक्कर में अभी स्ट्रेस, काम का प्रेशर एंड अदर स्ट्रेस लाइक टुडे इज़ द लाइफ ऑफ स्ट्रेस, सो everyone is stress now or tensions occur, so it it can it can be occurred. And obesity, weight is a risk factor, highly riskable. If weight is increasing of an patient, then coronary artery disease can be occur, because fat increase, muscles movement is not much more in fat or obese people, so it can lead to this diseases. And obese person are more prone to diabetes and hypertension and hyperlipidemia. Hyperlipidemia, in which the lipid level of the body is increasing. So lifestyle can also lead to that obesity, and obesity lead to hypertension, and hypertension lead to the diabetes and other stress level or behavior. So these risk factors are also correlated to one and each other. So all over, it concluded that these are the etiology of the coronary artery diseases. So friend, you can understood that coronary artery disease is now spreading day by day, and cases are more increasing day by day of this diseases. So here you can understood what is coronary artery diseases, and what is the meaning of coronary artery diseases, in which atherosclerosis is a important word, and here are some running notes. So this topic is, you can understood from my video, and thanks to watching our चैनल SK स्टडी। अगर आपको ये वीडियोस पसंद आया तो प्लीज़ लाइक करें, सब्सक्राइब करें एंड शेयर करें, एंड सजेस्ट ज़रूर करें कि आपको नया टॉपिक कौन सा चाहिए। सो थैंक यू फ्रेंड्स।